Hi, I'm Stempien-Otero. I'm an associate professor of medicine here at the University of Washington Medical Center in Seattle, Washington. I'm a transplant cardiologist and a translational scientist, and I'm here to tell you about our experience here in Seattle with COVID-19 over the past 41 days. Since the outbreak of the epidemic, our patients have been really worried about, are they going to acquire the disease, and how can they get care for their routine heart failure and transplant needs while we're in the midst of this pandemic. So we've altered a lot of our policies and procedures to make sure that we can continue to give the best care to our patients and to treat those who need us who end up with COVID-19. At this point, we've moved most of our clinic to telehealth, which, as you can see here, our clinic is very empty most of the time now, just physicians sitting in rooms with Zoom cameras talking to our patients who really enjoyed being able to have the connection. We've cut off our biopsies to only the most essential patients who we need to screen for rejection, and overall have gone on taking care of patients as we always have. We've also continued doing heart transplants. We realize that the risk of dying from heart failure for most of our patients is way greater than the risk of dying from COVID, and our hospital-acquired COVID risk is extremely low. So we've been able to reassure them that it's safe to get a transplant at this time. To make sure of that, we've actually cohorted our transplant patients into a separate team that does not take care of any COVID patients to reduce the risk of cross-contamination between the groups. Since the beginning of the pandemic, our hospital has been incredibly committed to protecting staff from getting infected with COVID. We have set up screening procedures such that patients, when they enter the door of the hospital, are screened. All visitors have been banned from the hospital essentially for over a month now to reduce the spread within the hospital. We have a 24/7 COVID MD on call who we can call and determine if a particular patient's symptoms warrant screening for COVID. And if they are felt to be a PUI, or person under interest or investigation, then they undergo PPE protections the same as if they had the disease. We've divided our PPE into two groups. So patients that do not have aerosolizing procedures are under a viral precautions with a face mask, shield, and gown. Now you may think, well, that's just what we do for influenza, but we have special people that are watching us put all of this equipment on to make sure we are both doing it correctly, and most importantly, taking it off without contaminating ourselves. As we don and doff, we call them the doffacers, to make sure to keep us safe. At the same time, for invasive procedures, anything that could require aerosolization like TEEs, cath lab procedures with deep sedation, then we are assuming airborne precautions and using N95 masks and or PAPRs. We are recycling our PAPRs with bleach washing of them, and our N95s are actually specially fitted for our faces, which has, unfortunately for the men, resulted in most of them having to shave their beards. Being in one of the earliest areas of the country to both have a case and have a patient die has made our community really jump on top of this early and set up procedures from the very beginning. My first email I look back was on March 1st, where we started our COVID procedures to change everything. And they have changed along the way as we've gained more data about the disease and about protections for all of us and about our PPE supplies into the future. I think that our PPE strategies have been incredibly effective. Our testing has shown that of all of the thousands of patients and staff who've been tested who have symptoms, only 4% of healthcare workers have turned positive for COVID, as opposed to 8% of the general public with symptoms. So I believe we're doing a good job at that. If I was going to do one thing differently, it would be from the very beginning to protect our proceduralists a little bit quicker and assume every patient has COVID until proven otherwise. We had some early exposures when patients came in with routine cardiovascular diseases and turned out to be COVID positive. And I just want to share that if any of your hospitals want to look what we've done, we have a forward-facing website called covid-19.uwmedicine.org, where you can see all of our procedures and policies and the dates at which we've updated them on the side. If you want to take any of these for your own, I really recommend it.